歡迎大家。
Welcome to today's press briefing. With us for today are Dr. Albert Zhao, Principal Medical and Health Officer, CHP, and Dr. Larry Lee, Chief Manager, Hospital Authority. Dr. Al, please. Fellow citizens, friends of the media, I'd like to report to you the COVID situation as at 24th of May. We have 104 cases of PCR positive, 23 from HA, 15 from Public Health Lab, and the remaining 66 are from the private labs. Yesterday, 147 are 80 positive cases. Yesterday, we have 251 positive cases. As of now, in the fifth wave, cumulatively, we have 1.98 positive million cases, 748,748 PCR positive, and 445,970 RAT cases, 28 imported cases, and the remaining are locally acquired cases. Of the imported cases, 10 were picked up at the airport or temporary specimen collection center. The remaining 18 were picked up at the quarantine hotel or in isolation, 2 on day 2, 3 on day 3, 2 on day 4, 11 on day 5, 1 on day 6, 1 on day 9 from a quarantine hotel. There are 8 from the US, 4 Thailand, 3 Australia, 3 the UK, 3 India, and 2 UAE, Singapore, Sri Lanka, Malaysia, Ireland, and Taiwan registered 1 each. In terms of genome sequencing, the Public Health Laboratory looked at 62 cases. 58 of them proved negative to L452R, and the remaining had low viral load. As to whole genome sequencing, we have 5 additional cases of BA.2.12.1, and there are 3 imported cases. 2 have to do with the McDonald cluster. Of the 3 imported cases, 1 involving a 41-year-old male with 3 shots, arriving in Hong Kong on May the 19th. And the airport specimen tested positive. On May 21st, he developed some symptoms. Another one, 33-year-old male with 3 shots on May 14th, arriving in Hong Kong from the US. And on day 5, testing RAT positive, and May 17th, he developed symptoms. The last one, a 14-year-old male with 1 shot. Earlier in Mexico on May the 2nd, he was confirmed with COVID. There were no symptoms. On May 14th, arrived from Mexico. At the airport, he tested positive, and this probably was a re-positive case. As of now, in Hong Kong, we have 69 BA.2.12.1 positive cases, of which 63 are classified as imported cases. 6 are locally acquired, related to imported cases. For imported cases, 2/3 of 42 cases are from the US, 5 from Netherlands, 3 Singapore, 3 the UK, 2 Canada, 2 Turkey. Of these cases, 48 tested positive at the airport, and 4 on day 2, 1 on day 4, 8 on day 5, and 2 on day 12 testing positive. Yesterday, there are 2 BA.2.12 cases involving a couple, both with 3 shots on May 19th, and they arrived from Canada. They tested positive at the airport on May 19th and May 21st. They developed some mild symptoms. As of now, we have 13 BA.2.12.2 cases, 5 from Canada, 4 the US, 2 Australia, 1 India, and 1 Germany. The vast majority of them, 11 cases, were picked up at the airport, 2 on day 5. Care homes, there are no care homes or RCHDs, and the reported new cases. Schools, as of PM yesterday, we have received 19 cases involving 19 different schools. Of these 19 schools, there are 15 students and 4 teaching staff members. 17 tested RAT positive, 2 tested PCR positive, and 1 on May 23rd, 6 yesterday, 12 this morning. There are 7 kindergartens come CCC involving 6 students and 1 staff member, 8 primary schools involving 6 students and 2 teaching staff, 4 secondary schools involving 3 students and 1 teaching staff. Of these 19 cases, they are scattered in different schools. One of them involved St. Catherine International Kindergarten, and this particular case is different from the class from yesterday, although this case is on the same floor. Now on Monday, it was the last day at school, and the person developed symptoms after school and testing RAT positive. The person didn't go to school yesterday in the afternoon. The person reported this to the school. This one has 2 shots. There are 28 students in this class. For the other students in today's RAT, they all tested negative. There are 5 teaching staff members testing RAT negative. We've been to this kindergarten to collect 6 environmental samples from the tables and the air purifiers and the exhaust fans. All the samples tested negative. In terms of death numbers, there are 2 new deaths yesterday. Cumulatively in the 5th wave, we have registered 9,159 cases. The fatality rate is 0.7642. In Taikusheng cluster, we have a new case involving a 66-year-old female who had 2 shots. She lives in Lamphong Estate, block number 9, on May 13th, around about 11:30 and 12:30. Together with 2 family members, she patronized this eatery, and on May 17th, she developed symptoms, and she tested RAT positive. Now, for her family members, they all tested negative, and her family members also tested negative. Now, for this cluster, there are cumulatively 9 patrons seated at 6 different tables, and it involved a family member of one of the patrons. The onset was between May 15th and 18th. For whole genome sequencing, we confirmed 2 cases, the BA.2.12.1, including a 67-year-old male and 76-year-old female. In our investigation, we collected 21 environmental samples, all of them testing negative. We had the samples from the tables, the air purifiers, and also the order monitor. The EMSC also conducted some investigation and had a look at the ventilation system, and the ACH, the air change per hour, measure up to the requirements.
Dr. Lee will now report on HA cases. Currently, there are 484 confirmed patients hospitalized, out of which 67 are new cases. And those who need to stay in isolated wards, 81 of them are in isolated wards, 17 in Tier 2 isolated wards, and 38 in the North Lantau Infectious Control Center. And there are 17 new cases in the North Lantau Hospital Infection Control Center. There are 4 patients in serious condition, and we have 10 in critical condition and 11 in serious condition, and 2 in critical condition are now in ICU. There are 2 male patients who passed away yesterday. So they are 78 years old and 98 years old. They are not from elderly homes. One has taken 1 shot, one is unvaccinated. 60 patients have recovered, and 44 of them have been discharged from hospital. Since the 5th wave, there have been 49,952 patients hospitalized, and 49,601 have already been discharged. And since the beginning of the year, there have been 62,332 patients with 62,061 discharged from hospital. And there have been 3 patients who were found to be positive while being screened at hospital. And there have been 23,059 staff members confirmed, and 23,006 of them have already gone back to their work. We now move on to the question and answer session. Please identify your media organization before you ask your question. Good afternoon from Now TV. First of all, I'd like to ask about the ventilation at Sky Cuisine, because it is found that the ventilation there is not very well. So is that the reason why there's been an outbreak at Sky Cuisine? And in November of 2021, there's already been an outbreak. So did the CHP inspect the ventilation system over there? Is it because of inadequate guidelines and monitoring that there's another outbreak at the Sky Cuisine? I also like to ask about the McDonald's in Taikoo. It seemed that many of the confirmed cases sat near the entrance or near the area where they took their meals. So how far away were they from the confirmed patient? Is it because they sat near where everyone can pass by? If that's the reason, then would there actually be a high risk to other patrons and to the workers over there? For St. Catherine's International Kindergarten, it seems that many of the children have taken school buses. Does the CHP know how many students were on the bus together? Or do you think that they were infected on the bus or in the classroom? For the new case today, they were not in the same classrooms. Did they take the same school bus? And how about you allow Dr. Au to answer questions first? Can you tell us more about the 2 death cases today, whether the patients had any chronic diseases? Thank you for your questions. On the ventilation system at Sky Cuisine, when we found that there was an outbreak, we immediately visited the restaurant together with the EMSD and the FEHD, and we conducted an inspection. We found that the ventilation on the 3rd floor was problematic. The connection and the ventilation system in the restroom was actually plugged in on the reverse, and it seemed that the operation was not regular. So we conducted investigation and found that the change of air every hour was less than 1. So there's actually a huge gap from standards. We suspect that on the night of outbreak, which was on May 7th, the air purifier was not turned to its highest capacity, or maybe some of it was not turned on at all. We request the restaurant to make improvements, and they have completed the improvements. We again took some samples after the improvements and found that the environmental samples are now negative. The ventilation system is now operating smoothly, and thus they can resume operations. When licenses are issued, there's a standard requirement for ventilation, and the restaurant must ensure that the ventilation is operating as usual and they abide by the guidelines. Under CAP 599F, there's also a requirement on ventilation, and the restaurants must comply to ensure that the ventilation system is on par. Otherwise, it would pose a very high risk. The relevant departments will conduct inspection to ensure that the systems run smooth. For the second question about McDonald's, we believe that the source of infection came from the 64-year-old who became positive on the 12th day upon arrival in Hong Kong. When she visited, it was during her incubation period, and she took off her mask to eat. She sat near the long table by the entrance. We understand where the other customers sat and found that the patients actually sat quite near to that table. It's not very near, it's at least a few meters away. But then they all sat together in the same area. The EMSD has visited the premises and found that the air mainly flow in from the lobby area into the restaurant. And then the air was then emitted out via the kitchen. So because of the high viral load of the first patient, and by taking off her mask, it caused a short distance transmission. We have taken environmental samples and found them to be negative. However, when we took the samples, the restaurant had already undergone deep cleansing. Therefore, we could not find any positive samples. For customers who visited the restaurant at the same time, we have issued a compulsory testing order. We have tracked down the majority of the customers. Many of them have already tested with negative results. We will continue to follow up. On the outbreak of the kindergarten, we believe that it has nothing to do with school buses. The cases are mostly concentrated in one classroom. Not all the students will take the same school bus. And currently, there are no new cases in other classrooms other than the one new case today. The new confirmed case today doesn't seem to be connected to the cases yesterday, and the student does not take the same school bus. The classroom, however, is on the same floor. We cannot rule out the possibility of transmission during the sharing of facilities. There doesn't seem to be other cases with the students in the same class of the new confirmed case. 27 students tested negative, and the 5 teachers all tested negative in that class. 2 people passed away, both male. The 90-year-old took 2 jabs. He had a weak heart and fibrillation in the heart palpation. So on May 4th, he visited Kwong Wah Hospital due to stomach pain. His kidney was weak, and we believe there was some sort of inflammation. On May 9th, it was found that he tested positive with a high CT value of over 30. When he became stable, he switched over to Kowloon Hospital on May 18th, and on May 24th he was found unconscious. We immediately tried to resuscitate him, but unfortunately he passed away at 4:51. The other male who passed away did not have chronic disease, some heart palpitations. He also visited A&E in Kwong Wah Hospital on May 14th, and he was delirious at that time. We believe that he suffered a stroke. After a scan, we found that other than the previous stroke, he also suffered from new stroke. We were not able to find out his CT value at that time, but later it was found to be over 30. He received treatment in hospital, but his condition continued to aggravate, and he passed away at around 9 p.m. on May 24th.
Lady in black, please. Cable news. The St. Catherine International Kindergarten, the environment sample results, have they become available, and where is the source of infection? You mentioned the student on the same floor but different class. Can you track down the sources? Also, Lan Kwai Fong Hotel cluster, the Nepalese father and son, and the couple from the US. Which one is the source of infection? Thank you for your question. The first question is about the St. Catherine International Kindergarten. We have collected 6 environmental samples, 3 of them from the table of the classroom in question, all testing negative. There are 2 samples taken from the air purifier, also testing negative. The other one from the exhaust fan, also negative. We haven't identified any environmental contamination, although the school or the kindergarten would do disinfection every day. We may not be able to pick up any virus. Now, there is a cluster in a classroom involving 6 cases, 2 a.m. to 4 p.m. and 1 teacher. In this cluster, it is likely that there was some transmission inside the classroom because they all developed symptoms within a short space of time, and the family members were fine, and we couldn't find the source. As to which one is really the index patient, it would be hard for us to determine. Probably one of the students or one of the teachers could have been the source. The one who developed symptom first was the teacher, and the teacher tested positive PCR. Now, for the new case, this is different from the class, and the 2 classes didn't have any mixed activities, and they were 2 separate classes. However, the classrooms are nearby. In this new case, on May 23rd, testing RAT negative, this person developed symptoms in the afternoon and tested positive in the evening. And the onset was about the same time as the other students. We cannot rule out the possibility that infection took place inside the school. We haven't found new cases. And on May the 23rd, the person developed symptoms, and that happened before all the measures were implemented. For the Nepalese father and son and the American couple, which one was the transmitter, it would be hard for us to determine, because in each cluster, in each group, there is someone who doesn't have any symptoms, and it would be hard for us to be precise when a person starts becoming infectious. And we took the PCR test. The CT value was high. That's after some time. So there are 2 possibilities. Both possibilities are valid. The route of transmission probably was via the sewage pipe, and some contaminated air leaked out of the pipe, and through positive pressure, the virus found its way into the room. Lady there, please. Dot on news. Now, for the Tai Kwu Sing McDonald cluster, the couple went home after a week of quarantine, and the husband was also in home quarantine. Now, overseas people coming to Hong Kong testing negative on day 5, 6, and the quarantine would be over. Would it be too liberal? Do you think there should be more days in the quarantine period? Now, for home quarantine needs, how can you step up your monitoring? You can speak in Cantonese. Do in Cantonese. The couple tested positive on day 12 after quarantine. They have completed the quarantine period. In Hong Kong, we're guarding against importation of cases. We do have very strict measures. One has to have a negative test result, and upon arrival, one has to test negative, and there will be a quarantine of 7 days. For Omicron, the incubation period is rather short. So for most of the imported cases, we should be able to pick them up within this period. By way of some numbers, starting from April through to a couple of days ago, we have about 1,000 imported cases, of which 57% were picked up at the airport, and there are 39 cases that were picked up during the 7-day quarantine period in hotels, and they didn't get into the hotel. There are remaining 40 cases that were picked up in the community after quarantine period. Now, for these cases, they had the infection record overseas, and we would investigate each and every case using the samples, and we do the whole genome sequencing to identify any particular variants. Either we couldn't complete the test, or they are positive cases. Now, there are 4 show in the whole genome sequencing that the variant that they carry was actually the variant that is dominant in Hong Kong. So it's probably the case that they pick it up from Hong Kong. So there are 2 cases that are newly infected cases on day 12. And we believe that for these 2 cases, because of the environmental factor or ventilation factor in the quarantine hotel, they probably got infected in the quarantine hotels. So it doesn't have anything to do with whether extend the quarantine period at all. If someone is infected in a quarantine hotel, the extension of the quarantine period may not be able to guard against this. After quarantine, the travelers will have to undergo 7-day surveillance. If there are any symptoms, tests will be conducted. And on day 12, there is a PCR test, and this is to ensure that should there be cases, we would be able to identify them straight away. Your second question? How to enhance the monitoring of the home quarantine? Well, if the home conditions permit, then we allow them to serve the quarantine at home, but they have to observe the quarantine order or the isolation order, and they have to stay in a separate room for isolation, keep the mask on, no contact with family members to guard against any transmission, and that's the requirement under the law.
再出個位女士。
你好，香港。Good afternoon from Hong Kong 01. For the new cases today, there is a 66-year-old female who was found positive on May 17th. So where has she been these days? Because we only know about her being positive today. And for the two who the BA.2.12.1, the 67-year-old male and 76-year-old female, remember 4 places have been subject to compulsory testing. Has any new cases been identified in those premises? There was a cargo flight from India yesterday and a person was found positive. Is that considered a local case or was it considered as an import case? Thank you. Thank you for your questions. The 66-year-old female who tested positive became sick on May 17th. She did a RAT, which was found positive, and she reported it to us yesterday. We found out she's positive through her reporting, and we will track her whereabouts. Currently, there is a cluster. Therefore, we are going to use the information on the vaccine pass. We found that she did visit McDonald's on May 13th. When she found herself positive, she stayed at home and did not visit any other places. Her close contact is her husband, and currently we know that he's still negative. The 2 family members who took meals with her are also negative. The 67-year-old male and the 76-year-old female during the incubation period visited some restaurants, and we issued compulsory testing orders. But we haven't found any new places or new confirmed cases over there. For the cargo flight, we took some samples from the confirmed place and will conduct a whole genome sequencing to see which variant he carries. Next question, please. Good afternoon, Economic Journal. I would like to ask about the St. Nicholas International Kindergarten. Which class was the student in? Do you need to suspend classes for now? If not, then what are the reasons for it? So how many cases or how big the outbreak would be before you suspend classes? As you said, the environmental samples found so far are negative. Do you think that it's a human-to-human transmission? Are there any teachers who teach both classes? The confirmed teacher yesterday still went to school, even because her RAT was found to be negative. Some experts said that if you tested for L452Q, you'll be able to identify the variant faster. The husband of the confirmed case you mentioned just now was in contact with 2 people. Are those 2 people still negative? Any follow-up on that? Thank you for your questions. The new case at St. Catherine's so far is the only case in that class. No other students have been found negative in that class. Therefore, we would not just suggest suspension of that class. However, we have requested the school to deep cleanse that classroom and to closely monitor the teachers and students of that class and to make sure that they undergo RAT testing every day. There are 5 teachers in each class and they teach only their own classes. They would not combine classes with others. I'll preliminary assessment shows that the new case is an individual case. We are not sure whether it's contamination from the environment. We would observe it. When there are new cases from the same classroom, then we might need to suggest a suspension of classes. We will closely monitor the situation of this class in the next few days. All teachers and students do a RAT before going to school each day, and therefore we are able to control the risk. Well, should students go to school when they show symptoms? Of course, we do not suggest doing so. First of all, students must take a RAT to see whether they are infected with COVID. Even if they're not infected with COVID, it might be other disease such as the adenovirus or upper respiratory tract illnesses. It might be other illnesses. Therefore, if you show any signs of unwellness, then students should not go to school. And to be on the safe side, then they should go for a PCR test because it is more sensitive and you will be able to know earlier whether you have been infected with COVID. The public health laboratories currently also analyze L452Q. And each day, when they do the whole genome sequencing, they would look how many are infected with L452Q and whether there is any signs of L452R. The laboratories are able to identify the Q subvariant. Each positive case would be tested for L452Q and L452R. Generally speaking, L452R shows a Delta variant, but we find that some Omicron variant, such as BA.4, may also be an L452R. But then when we find BA.2.1.2.1, then we would conduct a whole genome sequencing as well to find out the exact variant. We have sent that person to quarantine, and that person is still negative. Are there any other questions? The gentleman over there. From AM730. Well, you said the new McDonald's case entered the restaurant at 11:30, but then it seems that the previous case actually exited the restaurant at 11:26. So does that mean that there is actually transmission through air? Did you view the CCTV to try to understand how far apart the patients enter the restaurant? Or why did that female confirmed case actually report being positive a week? Did she email you, or how did she notify you on the positive case? And for St. Catherine's, why is there no need for class suspension? And are there any other cases aside from the cargo crew from the flight from India?
Thank you for your question. The source patient at around 11:30 left the eatery for this new case. We haven't got the Leave Home Safe app information. The person remembered that arrival at the eatery was about 11:30. There was some overlap period. we have to find out more, but we presume that they might cross one another on their way in and out of the eatery. So there are two possibilities. Either it was a face-to-face contact and transmission occurred, or it was a short-range airborne transmission, or less likely it was it could be an environmental contamination. The source patient, index patient touched the surface, someone else touched the surface as well, but this possibility is less likely. The first two possibilities are more likely, so we have to find out more about the ventilation, about the all the rest of the factors. For the new case, on May 17th, he developed symptoms. Now we received the declaration from the online platform, and we started the investigation. We found that there is a connection with this particular cluster. Normally, the declaration would cover yesterday and today's sample. The positive sample was dated May the 13th. In fact, on May the 17th, this person tested positive, and we started the contact tracing. The third question about the classroom and environmental sample, we didn't go to the new classroom for the sample because this is one single case, but we will keep this under observation. The last question about the cargo flight, we haven't found any related cases. That's the end of the press conference. Thank you very much.
Sorry.
The speaker not speaking through. Yes, indeed, we recommended that the students will have to undergo RAT test. If there are any positive cases, they have to declare them. And for parents also, they have to make the declaration. The students will have to file the school's address. We will know about it. Thank you very much.
下晝班
PM session.